let's learn all about lip injections, and I'll teach you some of my tips and tricks. You guys all know how to do good lips. What's going to take your practice of lip injections to the next level and elevate it is fine, precise injection techniques. So I'll show you some of the things that I do. So the first step is going to be visualizing where you would like to create some points of light, and always imagine the sharpest placement of your Cupid's bow. Always discuss with your patient, do they want to have a sharp Cupid's bow? If they don't, and they prefer a rounded Kylie arch, that's another point of discussion. I like to mark where I would like to see the filtral lines, and I'll start at the very apex of the Cupid's bow and draw a diagonally placed line that comes up to the columella, and something that you imagine in your mind's eye is going to lift and elevate the lip upward and outward. That gives that nice little extra poutiness. We are going to place an extra droplet of filler right in here. Right in here. I also want you to visualize the natural tubercles of the lip, and let's point out her midline is here. Her natural tubercles are where light is reflecting already. These are the highlight points that as I do her lip filler, I'm going to literally place some filler here as a highlight point, as a defining point. That's going to look lovely. I notice where the lip has areas of deep depression, and I also notice the areas around the lip. So I'm looking at the piriforms to see if they're recessed and hollow, if there's deep medial cheek volume loss, because that's going to contribute to elongation of the lip. And then I may be adding some filler in the piriform just to get the lip to rotate up and out. I'm also going to look at the mental nerve foramen here and decide how the canine teeth are impacting the lower lip. When the dental arch is very symmetric and they've had braces and wonderful teeth, the lips will protrude evenly. In her case, the lip protrudes more here and has a recession point here, and that's where her canine tooth falls in down here. So if you try to correct that by constantly adding to the lip, you'll never get symmetry. Sometimes we really do need to place filler outside the lip, so even here at the level of that canine tooth, to bring that area forward to give lip support. I think that's so important. I also do like to assess the depressor anguli oris muscles, because if we have a chronic downturn to the mouth, we need to sometimes place some neurotoxin in the depressor anguli muscles and bring the corners up. In terms of filler, one of our most neglected areas is the corner of the mouth. So if you don't place an aliquot of filler in the oral commissure, you're going to have this area where the upper lip is full, the lower lip is full, and the middle has a disconnect. And I think it looks very pretty when the lip extends all the way out and doesn't get truncated and just look full in the middle. So that's another point of finesse where you should definitely pay attention. In terms of her lip anatomy, remember your facial artery is going to cross here. You can palpate and feel right at the border of the angle of the mandible and the prejowl sulcus. That's where your facial artery passes. And if we palpate that, we have a mild sense of which direction our artery is going to be coming up at. At about 1 centimeter away from the lip and 1 centimeter below the lip is where there will be a bifurcation, and we will have labiomental artery coming up and crossing over and then dividing into the inferior labial artery and the superior labial artery. And these arteries dive between the mucosa and the orbicularis. And if you are going to use a technique where you're staying superficial and at the vermilion border, you're going to have good protection. You're never really going to fall into a danger zone. Your needle can be placed so superficially that you can virtually see the stainless steel color of it, and that's going to allow you to have safety. The things that keep you safe when you do lip filler are staying superficially, number one. Number two, palpating, because we can feel pulsations of the lip before we even begin, and we can realize when there's superficial or irregular location of anatomy. And number three would be aspirating. We'll enter the lip with the needle with the tip of the needle facing upright. And I do like to see the bevel up because that means the sharpest point of the needle is entering the lip first. And then I can aspirate by pulling back on the plunger. I'm going to use my opposite hand to guide to make sure that filler stays within the border of the lip. So my hand is abutted directly against my filler and helping to form that roll of filler as it extrudes. The retrograde linear technique is going to be your best bet. And for patients that want subtle results, always, you're going to have beautiful lip definition if you follow the vermilion border and don't violate the white line of the lip. So now I'm going to enter the lip and follow the length of the needle, aspirate a little bit, and then inject with a small, thin, linear retrograde thread. I think that the slowest lip injections turn out the best, actually. She has a little teeny bit of bruising here, which we're going to just put some pressure on. When I inject extremely slowly, that's when patients have the best results. So here my needle is so superficial that I can see it. relatively about 1 or 2 millimeters under that thin lip mucosa lining tissue. And here I'm injecting retrograde and linear threads. My favorite technique here is to place a small bolus of filler right at the top of the Cupid's bow. So I'll grasp the entire area of the Cupid's bow, enter, and place a 0.5 cc bolus directly in the Cupid's bow. I also like to trace and outline the philtrum. And in your mind's eye, once you visualize where you're going to have the philtral line lay, it's very important to grasp and pinch the skin so that you direct the filler, so filler stays exactly where we want it to be. So I'm pinching firmly, and then a retrograde linear thread to pull that filler off. Your patients are going to come in having had some lip filler done and still wanting more, and that's a definite role for doing this vermilion outlining technique. I also like to do a technique of placing cleavage on the lower lip. That's another way to treat an already full lip. Let's go ahead and do some cleavage on the bottom lip. I generally will start at the exact edge of the lip, and we talked earlier about not ignoring the corner of the mouth. Now we're going to continue that injection all the way across. If we want to maintain the two delicate pouts, we do want to have a cleavage, so I'm going to leave the mid-central area slightly empty. One other nice important thing to do is place a bolus of filler right at the oral commissure. Open a little wider. There you go. And that's placed very superficially, and you may even see it, and you may even feel it for a few days. But I do like to place that because it gives a little pillow or cushion so that the upper lip can have something to touch onto and protrude out better. Sometimes when I see that there is a little tendency for that marionette fold to be beginning, even at a young age, people can get that from side sleeping. So when I'm seeing that early tendency for that marionette fold to begin, I will also add a strand of filler to create a bolster and a buttress, a little buttress of support here. It's very important that you allow the patient to edit your work. So I save a little drop of filler for that last look, because they might notice something that you might notice.
It looks good.
It's beautiful. Looks really pretty.